I can do a jockey over the horse. Notice my position is where I'm kind of straddling, so I have one leg in front and one leg in back. And my leg, my force is all, my weight is all on my front leg. My left leg is just, I'm not really putting weight through that. And I'm basically leaning over the patient. You guys are shorter, patient's bigger, feel free to get on the table. Right? I have a colleague gets on the table all the time, that's fine. Okay? As long as, I'd rather have you get on the table and have the force be straight than have it where you can't really, and you're giving it more obliquely. Okay? So you want to make sure you're there, jockey on the horse, you're on that spot, take up the slack in the joint, and then you're mobilizing. So if I can see you across the room mobilizing, you're probably doing too much. Mobilization, when you're looking at it, should barely look, you shouldn't even really be able to see the oscillations because we're only talking about millimeters of motion. This hand is the dummy hand, it's just maintaining contact. This hand is the mobilizing hand. Right? So this hand is doing all the pushing, this hand is just hanging out. Okay? That's one choice. Another choice, I could use the piezoforms on either side, and if here's the spinous process, I could go on the transverse here and the transverse here. So I'm at the same level, and I'm just pushing the transverse processes together, or forward. Okay? Trying to push equally on both sides. If I'm not, I'm getting rotation. Right? So I want to make sure I'm pushing both equally. This is kind of the McKenzie method of doing it. Stanley Paris also recommends doing a split finger approach. So I'm splitting my fingers like this. Transverse process at L2 on the right, transverse process at L2 on the left. So they're both on the same transverse process of the same segment. And then I'm using my palm to provide force through each of them. So I'm pushing this way. Okay? So we're looking for ways of improving comfort for the patient. Okay? 9 out of 10 times, I'm telling you, the reason why this may be bothersome to the patient is because you're not doing it right. Okay? So if you really get your hand in there and you really kind of make it comfortable to the patient, a lot of times you can do these techniques, even grade 4s, without having discomfort. A lot of times you may abandon this because it hurts them. It's probably because you're not taking up the slack and you're not getting your hand in there and making good contact. Okay? So you can play with any of those approaches. All of those are fine, in my opinion. There's no right way to do it. What's important is that you make sure the force is going straight anterior. So, if your arms are over here, that's a point off kind of thing, right? Because that's not an anterior glide. That's an anterior lateral glide, right? Now, do we do that? Sometimes you may want to do that, but not if you're calling it an anterior glide. Okay? And then the unilateral, which is really the same thing, we can just keep going, is the same deal. We have our dummy thumb contacting what for the unilateral? Transverse. And then our other thumb, right, providing anterior glide. I talked about, this other thumb CMC joint often gets beaten up here with this technique. So I'm on that spinous, on that transverse process, I rub up and down, I'm on it, and then this thumb is going to basically just provide force in the same anterior direction. And again, I'm in the same position, my nose is leaking over the mobilization, okay, and I'm providing that force. Now this is a great way to assess motion. I can really get a sense of where that motion is. If I want to mobilize and I'm doing this all day long, I may choose to use my dummy thumb and then maybe use my distal piezoform region to produce that mobilization. Right? Or I may just use the distal piezoform on that transverse process to produce that mobilization. So again, it's up to you guys as far as where you want to go. You just want to make sure that your force direction is straight anterior. Okay, so dummy thumb or piezoform. We're looking at central PA glides or central anterior glides and unilateral anterior glides. Unilateral producing a rotation, right? An asymmetrical mobilization, something we may do with the McKenzie approach. If there's a lateral component, we may incorporate a unilateral glide, right, to work on that rotational unilateral component. Right? And then we have the central glides. Most basic form, we're not trying to lock anything out, very general. We're mobilizing segments, but mainly the segment that we're on.